I'm Jeffrey Sachs, university professor at Columbia University and director of the United Nations Sustainable Development Solutions Network.
Jeffrey Sachs, welcome to the China Current, and thank you very much for sharing this time. I want to start by asking you how you are and how you feel about 5 months into this pandemic, which is not only quick, it's flexible, and some would say very ruthless.
Well, it's a very frightening time. My family and I are sheltered. New York City is one of the world's epicenters of the pandemic right now. Our country was not ready. It did not prepare, and it became overwhelmed by the epidemic. I'm also very worried about politics. I'm very worried about global cooperation. I'm very worried about poor countries that don't have the resources to cope. So there's a lot of reason for worry right now.
A lot of people have been talking about therapies and vaccines. Is that going to be an answer to ending a crisis that has taken on significant social and economic dimensions?
I could be wrong, but typically vaccines are developed in the course of years, not months, whereas epidemics rage in a matter of weeks and months. So I don't think that it's going to be the vaccine that will be the immediate response to this epidemic. There are various ways to slow or stop or reduce the transmission of the disease. One way half the world is using right now is closing down a lot of economic activities so that people don't go out and they don't mix. That's an extremely costly approach. Why is it being done? Because these governments haven't done the alternative of focused case identification, focused isolation, focused quarantine. And so what I keep arguing in the US and internationally is the lockdown approach might have been a last resort as the epidemic was overtaking countries, but we have to move beyond that by moving to public health. We need to be screening for fever by all of the thermal monitoring equipment. We need to have hand sanitizers. We need to stop shaking hands and hugging right now. We need to avoid large events that could become super spreading events. That's usual in Asia, but not usual in most of the rest of the world. If we're not smart, the only alternative is closing down economic activity, which is terribly expensive and a huge, huge cost for lots of people who have no alternative but to go out and work.
You mentioned Asia there, and you've written about what you call an East-West divide, where you say East Asian countries are generally outperforming the United States and Europe in terms of their response success. Let's start off then with China, the biggest of those countries in the Asian region. How well do you think, or how well not do you think, it performed in its early outbreak and since?
Well, the China story is complicated and there are still pieces to be filled in. The epidemic began sometime in late 2019. We don't really know when precisely. Wuhan made a very serious mistake at the start of the Chinese New Year, the 18th of January, where there was a massive New Year's party of thousands and thousands of people. This definitely spread the disease widely. Then those people dispersed to different parts of China and across the world, and that was a spreader of the disease. I think China's leadership realized this was out of control at that point. And on January 23rd, Wuhan was locked down, then Hubei province, then all of China, basically. From that point on, China's performance has been remarkable. Indeed, China showed what I think most public health experts would have thought to be impossible, which is that even after an epidemic has broken out, it can still be contained, because China battled this disease back down to near zero, not to zero, but to near zero. It's a remarkable achievement. It gave hope for the rest of the world that you could actually fight the epidemic, not just suffer the epidemic. In Western Europe and the United States, politicians and the system was asleep at the switch. Even though there were plenty of alarm bells going off, there wasn't a public health response. Now we're paying the price. The virus spread across the country. The epidemic spread across the country. We have more than 40,000 deaths. New York is at the center of that for the moment, but this is a disease that's all over the United States. So I would say the performance has been differential. East Asia better, more alert, prepared by SARS, better personal hygiene in the sense of physical distancing, face mask wearing. If you go to an Asian airport, you almost always walk through a quarantine desk and the scanner is on. In US airports, not at all. In European airports, not at all. In other words, East Asia is much more prepared for epidemics than Western Europe and the United States. And these rich countries of the West are paying a fearsome price for that.
When you mentioned the word China, a lot of red flags go up for different people. Do you think that some people are allowing those emotions to get in the way of seeing lessons that could save lives in their own communities?
We have to cooperate. It's the only sane thing to do. And therefore, I really hope we can find a way to lower the tension dramatically, not politicize what is not political. The virus is not political. It wasn't unleashed by anybody. It wasn't caused deliberately by anybody. It is a tragedy that we need to control together, cooperatively, as fast as possible, period.
The China Current continues its special coverage on the coronavirus outbreak. Go to our social media at The China Current and our website for interviews, videos, and podcasts. I'm James Chau. Thank you.